All right. Hello, everybody. Welcome to our webinar today. Our topic is basics of chronic kidney disease. And we are just excited to share this webinar with you today. Just to tell you a little bit about it and how it's going to go. Our format includes a short presentation followed by an interactive discussion at the end, or really anywhere, anytime during the presentation. If you think of a question, you can use the question section of your webinar toolbar to just type in your question. All questions will be answered at the end after the main part of the presentation, but definitely ask away if you think of a question, because we do look forward to this being an interactive webinar. And some disclaimers. So your Cecelia Health registered dietitian will provide strategies to help manage your chronic kidney disease. And we know that some of this information you're about to hear may motivate you to make lifestyle changes, but please, we ask that you consult your physician before making any changes to your current routine. So this online information Q&A session is intended to give general advice, and the Q&A session in particular is information is not a substitute for personal medical advice and involves the professional opinion of the Cecelia Health registered dietitian. All right.
That's all right. Hello, everyone. My name is Katie Gray, and I am a Cecelia Health registered dietitian. I'm so excited to present the basics of chronic kidney disease to you today. A little bit about myself. I have been a dietitian since 2016, so I've been doing this a little over 7 years and really just helping educate people on dealing with chronic diseases in general. So preventing them and managing any chronic disease that you might have, and really just trying to educate and empower, my patients and my clients to understand what's the relationship between diet and their health and how I can help them feel their best. So on a personal note, I enjoy being outside with my husband, my very large dog, and our 1-year-old daughter. So you can always find me moving outside, hiking, kayaking, all of that wonderful stuff, especially in the summertime. Okay. So let's just dive right in. So just so you get an idea of what we'll be covering today, we're going to start out with, what your kidneys actually do and how they work. Then we'll see what is chronic kidney disease, so what's happening when they're not working so well. What puts you at risk for chronic kidney disease? Complications that are caused by having chronic kidney disease, so how it affects the rest of your body. Some symptoms you may notice if you have not yet been diagnosed with chronic kidney disease or you do have chronic kidney disease, some things to look out for. Then we'll talk a little bit about how chronic kidney disease is actually categorized into stages and how it progresses. We'll discuss how your doctor can actually diagnose this. And then we'll get into, the meat and understanding how we can actually manage chronic kidney disease and preserve the health of our kidneys and, prevent further decline. We'll touch on medications that can help your kidneys, as well as end with some reliable resources and some more support for you on where to learn more about chronic kidney disease. So let's get started. So your kidneys are vital organs. So that means we cannot live without them. Some people are born with one, but most people are born with two. And so if you hold up both of your hands right now and make a fist with each of your hand, that's about the size of your 2 kidneys. And then if you take those hands and put them behind your back and kind of sit them above your pelvis and below your rib cage, that's kind of where your kidneys are located. And our kidneys are kind of the filtration system of our bodies. So they remove waste and excess fluid from our bodies. So what they do is all of our blood gets pumped through our kidneys and they filter our blood. They also make vitamins that control our growth, and they are responsible for producing our red blood cells. And so those red blood cells are really important for carrying oxygen throughout our body. Lastly, they release hormones that help regulate our blood pressure. And that's something that we'll be talking about throughout the presentation, is this very close link between our kidneys and our blood pressure. And here's another nice picture that just kind of shows how the kidneys work. So as I mentioned, all of the blood in our body gets pumped through our kidneys. So starting at the heart, our heart, has a heartbeat. It pumps that blood out through an artery and then goes through our kidneys. And when the blood is passing through our kidneys, there's these little things called nephrons, and those are kind of those filtering devices. So if you can think of any type of filter, an air conditioner, the car filter, the air purifier, there's kind of this little filter or barrier to kind of keep out all of that, dust or waste that we don't want. And so that's what these nephrons are doing in our kidneys. And once they filter the blood, all of the waste and excess fluid that we don't want in our bodies anymore is sent down through those white tubes called ureters. And that is what brings that waste to our bladder, which is stored as urine. And then, as we know, throughout the day, we urinate, getting rid of all of that excess fluid and waste that our kidneys so nicely filtered out for us. And after the kidney does its work, that blood that passed through is going to go into our veins and go back through our body and up to our heart again. And that process is going to repeat all over again. So we understand now how the kidneys work in our body. And so what does it mean when they're not working very well? So chronic kidney disease, which I'll refer to as CKD in the rest of the presentation, just to save myself some words, can also be called chronic kidney failure, involves a gradual loss of kidney function. So this is a key piece of what we're talking about today. So the kidneys are going to gradually lose function, and that's when we can diagnose chronic kidney disease. And this is as opposed to an acute kidney injury or acute kidney failure that just happens right away out of the blue. So this is going to kind of develop over time. And more than 37 million American adults may have CKD. And the crazy thing is that most are actually undiagnosed. So as many as 80 to 90% of people may not even know that they have CKD. And we'll talk a little bit about why later. And advanced chronic kidney disease can cause that fluid, that waste that normally leaves our body to build up in our body. And that can cause many complications, which we'll talk about next. And so there's a nice little picture down here at the bottom. So on the left, you'll see a nice healthy kidney. And as we progress through the stages of chronic kidney disease, you can see that kidney starting to look a little weathered, a little less healthy. And so as it loses function, you can see that kidney kind of decreasing in size, and internally it's not going to be able to work as well filtering your blood. So what puts you at risk for CKD? So this nice picture here, the top left, diabetes, that is the #1 cause of chronic kidney disease. So if you are living with diabetes, it is very important to manage that blood sugar and kind of understand your diet, your medications when it comes to keeping that blood sugar within the normal range. Next up is high blood pressure. So this is the second leading cause of CKD. As I mentioned in the beginning, blood pressure and how our kidneys function is very closely linked. So it's very important if you do have hypertension or high blood pressure to work with your doctor and work with your health coach on changes to help lower your blood pressure through things like medication exercise, diet, and stress management. Some other things that may put you at risk for CKD are existing heart problems or a history of stroke, living with obesity, if you have a family history of CKD, if you are a smoker, and then also if you are over the age of 60. And so, once we reach the age of 60, our kidneys have been working hard for a long time. And so at this age, it just means, there is an increased risk of kidneys losing some of its function. Some other factors listed here at the bottom. Race can also be a risk factor. So if you are Black, Native American, or Asian American, you may be at higher risk of developing CKD. If you're born with abnormal kidney structure, this could potentially cause a decline in that kidney function over time. And then lastly, consistent use of medications can possibly damage your kidneys. So some of those medications include common pain medications. So something like ibuprofen or Motrin, aspirin, naproxen, those are some examples of some medications that if used for a very long time or used more than you should or not advised by your doctor, that could potentially cause some kidney damage too. So when you have CKD, what is happening in the rest of the body? So as I said, that kidneys are responsible for getting rid of that excess fluid. So when they're not working quite as well and we have that fluid build up in our body, that causes swelling, usually in your feet, your legs, hands, arms. Those are that's a common symptom too of CKD. You might also notice high blood pressure if you didn't already have high blood pressure before your CKD, or that fluid can actually build up in your lungs. And so if you notice shortness of breath, even with just walking 1 to 3 blocks suddenly, that could be a sign that you might have some fluid buildup. A sudden rise in potassium levels is also something that can happen when our kidneys aren't working well. So our kidneys are responsible for getting rid of that potassium that our body doesn't need. But if we have too much potassium in our body, that actually can affect our heart. So potassium helps regulate our heartbeat. And so if there's too much, that may cause our heart to beat too fast or other arrhythmias that can be life-threatening. As I mentioned, our kidneys are responsible for producing our red blood cells. So if our kidney is not functioning well and it's not producing those red blood cells, that means our body is getting less oxygen, and so that can cause anemia. We mentioned heart disease can be a complication of CKD, weak bones, and increased risk of bone fractures. People often wonder, how the heck do my kidneys affect my bones? Well, our kidneys help kind of balance phosphorus and calcium in our blood. And so we know that we need calcium for strong bones. But when our kidneys aren't working quite as well, something called phosphorus can build up in our blood. And what calcium wants to do is calcium wants to leave our bones and go into our blood to help balance out that phosphorus. So if calcium is leaving our bones, that means they can get weak. It can also cause decreased sex drive, erectile dysfunction, or reduced fertility. Pregnancy complications that carry risks for both mother and baby are very important to discuss with your doctor if you are in that stage of life. It can damage your central nervous system. So if you notice that you can't focus like you used to on normal tasks, difficulty concentrating, or noticing, changes in personality or mood, this would be something to mention to your doctor. Our immune system can be compromised, meaning we can get sicker more easily. Our heart, the pericarditis, which is kind of a sac-like membrane that protects our heart, can become inflamed. And if CKD isn't managed well, it can eventually lead to end-stage kidney disease or kidney failure. And so at that point, that's where you would need dialysis or a kidney transplant for survival. And so I have some symptoms here of CKD listed, and I won't read them all to you, but just take a look. And you can notice that a lot of these symptoms are pretty general. They're pretty common. So something that you can experience that could maybe be caused by a host of issues. So if you do notice that if you are experiencing some of these symptoms and maybe say you haven't been diagnosed with CKD yet, or you have been, but really haven't been having any symptoms, definitely make sure to bring this up to your doctor if you do notice anything new or anything that worsens over time or doesn't go away. As I mentioned earlier, CKD is kind of categorized into stages. So this is a nice picture here that shows you the different stages, 1 through 5. Stage 3, you can see, has kind of 2 categories there. But starting at stage 1 and 2, so you can see there's mild kidney damage, but your kidneys are still working pretty well. At these stages, you often don't have symptoms of CKD. So one of the first slides we talked about, many millions of Americans not even knowing they have CKD. And this is often why those symptoms sometimes don't show up until stage 3 and sometimes even stage 4. And so you can notice stage 1 and 2, as I mentioned, is categorized or diagnosed by something called this eGFR. So in that purple column, you'll see a second thing down is called your eGFR, and that is called your I always have trouble saying this, glomerular filtration rate. It's basically just a measure of how well your kidneys are filtering your blood. And so based on this number and other factors determined by your doctor, this can help put you in or help understand what stage of kidney disease you're in. And in stage 4, you notice that, the waste that is starting to build up and maybe some fluid buildup can start causing some of those complications we talked about, like high blood pressure, bone disease, and heart disease. I think one symptom that may not have been listed on the previous slide too is that lower back pain. Once again, a very common thing people experience and can have a host of causes, but that can come along with CKD, that lower back pain, since that's exactly where our kidneys are located. So if you're not sure, if you know you have CKD, but maybe you don't know what stage, definitely a good question for your doctor. Or if you haven't had your blood work done in a really long time, this is something that you can ask your doctor about to see if they want to check and just to make sure you can understand how well your kidneys are doing right now. So how does your doctor diagnose CKD? As I mentioned, there's that GFR blood test, and that is really the most common thing that doctors look at and kind of the main criteria for diagnosing CKD. So it's just a blood test, a normal blood draw, nothing extra, and it's just, once again, measuring how well your kidneys filter your blood. Another way they can see how well your kidneys are doing is by just a urine test. So they will look for something called albumin in your urine. So that is a protein that when the kidneys are damaged, passes into the urine. So if you have a higher amount of albumin in your urine, that will point towards CKD. Some other tests that your doctors might do for you, another test looking at that urine is the albumin to creatinine ratio. So once again, albumin is a protein that'll pass into your urine. And then creatinine is something that they will also detect in your urine as well. So it is a normal waste product that just comes from wear and tear from the muscles in the body. But if you have CKD, that amount that passes into your urine will be higher. You might have imaging done, so they can just use an ultrasound. So that kind of little wand pressing on your back to take a look at your kidneys and take a look at their structure and their size. And lastly, if your doctor is having trouble diagnosing your kidney issues, needs a little more information, they might want to do a biopsy. So this would just mean going in and taking a teeny tiny piece of your kidney and sending that to a lab for testing. But most of the testing, most of the time, can be done through that blood test and those urine tests. So we just went through a lot about what CKD is, these tests, showing the progression, those stages of kidney disease. So, I do want to share a lot with you on how you can manage CKD. And so once you've been diagnosed with CKD, unfortunately, there is not a cure. So we cannot make your kidneys go from stage 3, back to no CKD. So what we need to do is understand how we can best preserve the function of our kidneys now and prevent them from losing more function. And that is how we can manage our CKD. So one of the biggest things you can do is working on controlling that blood pressure. So when our blood pressure is high, just imagine that kind of more force, more pumping going through our kidneys, making our kidneys work harder with that higher pressure. And so if we can work on things like diet, exercise, stress management, and sleep, along with any medications that your doctor prescribes, this can really help keep your blood pressure within that normal range. So that magic number we often hear is 120/80, but definitely consult with your doctor to see what the best goal is for you when it comes to monitoring your blood pressure. Controlling your blood sugar is also extremely important. If you remember, diabetes is the #1 cause of CKD. And so if you are living with diabetes, or even maybe your doctor mentioned that you have pre-diabetes, this is definitely something that can be managed through diet, especially working with your dietitian, health coach, and your doctor on ways to help keep that blood sugar down. When we keep our blood sugar within that normal range, that just means it's given our kidneys a little bit less work to do. And then it's important to monitor your kidney health with your healthcare team. So as I mentioned, when we were talking about ways to diagnose CKD, those are often things that your healthcare team or professional will want to monitor to just keep an eye on your kidneys and making sure that they are not declining in function further. Very important to take medications as they are prescribed to you by your doctor. So following those instructions and taking them as prescribed. And that's something that if you have questions, always ask your doctor that prescribed them to you. And your pharmacist might be part of your healthcare team as well. And they would be a great person to ask too. Work with a dietitian to create a meal plan. So that's a big part of our program here and how we want to help you. So understanding how diet can play into your kidney health, how it can help prevent that further decline in your kidney function. And we love to understand, your favorite foods, your likes, dislikes, preferences, lifestyle when it comes to cooking and grocery shopping. So that's definitely something that you can work with your health coach on. Making exercise a part of your routine can be very helpful for our overall health, but also for lowering our blood pressure, managing our blood sugar, staying at a healthy weight, all things which can help out our kidneys. Getting enough sleep, restful sleep, quality sleep, helps our body kind of rest and refresh for the next day. If we're not getting quality sleep, that can be a stress on our body, which means a stress on our kidneys. If you are a smoker, quitting smoking can do wonders for, once again, your whole body, but your kidneys especially. So smoking raises our blood pressure, and we know that high blood pressure makes our kidneys work harder. So if you are a smoker, there are many resources out there for you. Smokefree.gov is a great place to start. They have phone numbers, text lines, programs, things you can find in your state that can help you quit smoking. And lastly, finding healthy ways to cope with stress and any depression or anxiety that you have. We know that, living with a chronic condition can be stressful, and just, you know, things happen in life that can be stressful, or we can go through some periods that are not so great. And so finding healthy ways with your, with your healthcare team, with your family, friends, support groups can be really helpful and really important for, managing your mental and emotional health, as well as helping out your body. Just a little bit about medications here. So there are actually no specific medications to treat CKD. Medications are prescribed to help out those complications of CKD, those symptoms, and some of those risk factors that can lead to CKD. So if you have diabetes, you might be on insulin to help manage your blood sugar. Or there are other oral medications like metformin, Ozempic, glipizide, things that can help lower your blood sugar so it's within those healthy, normal ranges that can help out your kidneys. High blood pressure, once again, very, very important to manage our blood pressure. And so your doctor may prescribe some medicines that fall under these categories listed here. So starting at the bottom, diuretics, those help get rid of excess fluid. If our kidneys can't do that as well any longer, those diuretics can help. We have something called beta blockers, which can help lower our blood pressure. So if you take a medication that ends in the letters OL, that's a beta blocker. So something like metoprolol, atenolol, propranolol, those all help our heart to beat a little bit more slowly and with less force, which can help lower our blood pressure. So angiotensin receptor blockers. So angiotensin is a hormone in our body that causes our blood vessels to become more narrow. So I always remember angiotensin. So it tenses up, it kind of narrows. That's my little helpful tidbit. And so the angiotensin receptor blockers, as well as ACE inhibitors, can help counteract those effects of angiotensin, which will cause high blood pressure. And so those ACE inhibitors, if you take a medication that ends in IL, so like lisinopril, enalapril, benazepril, those are all examples of ACE inhibitors. And those angiotensin receptor blockers, that's something that ends in AN, so something like losartan or valsartan. Those can all help lower your blood pressure. Similarly, some of those same medications are used to help manage heart disease. So anything else going on with the heart, along with that high blood pressure, can help. And as well as that last one listed there, potassium binders. So I mentioned a little bit in the beginning that if we have CKD, we are at risk of maybe some potassium building up in our blood, which can affect our heartbeat. And so potassium binders, when we take them, they kind of find that potassium in our blood, kind of take it under its arm, and then helps escort it out of our body so that our potassium levels can stay normal. Next up, you may have high cholesterol, or your doctor might want to prevent you from ever getting high cholesterol. So they might prescribe something called a statin. So something called Lipitor, atorvastatin, rosuvastatin, Crestor, those all can help lower your cholesterol, which prevents any type of buildup in your arteries. Anemia. So we mentioned that kidneys are responsible for producing those red blood cells, which carry oxygen throughout our body. So if you are experiencing anemia, they might prescribe something called an erythropoiesis stimulating agent. So erythropoiesis is just a fancy word for red blood cell production. So they'll give you a medication to help make more red blood cells. They also might prescribe you just an iron supplement to help boost that as well. Some other medications here related to some of those complications. Sometimes the pH of our blood can change, so it's something called metabolic acidosis, so they'll give you something to balance that out. If phosphorus is building up in your blood, as we mentioned, and causing that calcium to come out of your bones, there are a couple medications that your doctor might give you to help preserve your bone density. And lastly here, we have a gland in our body called your parathyroid gland. And this gland helps balance that phosphorus and calcium in your blood. And so sometimes our gland can start working too hard if it's trying to take over for some of that work that kidney was doing to balance that phosphorus and calcium. So if that happens, your doctor might give you a medication for that too. And so some great resources, if you want to learn more about CKD, find good recipes, answer, any question you might have about CKD. These are some really, really great websites to check out. So the National Kidney Foundation and the American Kidney Fund are really great websites to go on, very user-friendly and easy to understand. So they have some great info for you there. The Centers for Disease Control and Prevention, so the CDC, they have a great page all about kidney disease, as well as the National Institute of Diabetes and Digestive and Kidney Diseases. So you can see there that diabetes and kidney diseases are in that same institute at the National Institutes of Health. So they have some really great information there and the latest research if you like reading about that. And last there on the list is the American Diabetes Association. So if you are living with diabetes or if you have pre-diabetes and want to learn more about those conditions, definitely a really, really great website to check out there. And so that wraps up the basics of CKD. So I hope that was a really great overview for you and helping you understand what CKD is, how it affects your body, and how we can help manage CKD to keep our kidneys as healthy as possible for as long as possible. And so you do have the option here to use the question tab on your toolbar. If you do have any questions about maybe something that I went over, something that I didn't touch on that you're curious about, and would just like me to discuss or answer the question. So please go ahead and type in anything now if you have any questions that came up during the presentation. And I'll give just a few seconds to review those. Okay. All right, so I have a question here. Thank you for asking. So what is the best food to eat more of to help your kidneys? So this is a really, really excellent question. And so a little bit about diet for kidney health. It does depend on what stage of CKD you are in. And so if you are stage 1 or 2, following a general healthy diet is going to be your best bet. So at that point, you don't need to restrict anything as prescribed by your doctor. And so, some things that are good to check out for just general healthy eating, something called the Mediterranean diet or the DASH diet can be great places to start. And so we talked a lot about blood pressure and our kidney health. Sodium is the big thing in our diet that is going to raise our blood pressure. So if there's one thing that you might want to start working on, I'd say, take a look at the sodium in your food. So keeping sodium lower in our diet can really help out our heart and our kidneys. regardless of what stage of CKD we are in. Some foods that are typically high in sodium, anything that's canned, so canned soups, canned vegetables, canned beans, those are often high in sodium. If you do buy canned items, look for low sodium or no salt added varieties. There's definitely a lot more available in the stores now. Broths, deli meats, processed meats like hot dogs, sausage, those are going to be higher in sodium, as well as any kind of salty snack. So like salted nuts, chips, pretzels, those are some typical items that might be higher in sodium. And so you can definitely work with your dietitian coach to understand maybe what foods in your diet now might be high in sodium. Otherwise, in stage 1 and 2, great to get a lot of variety with those fruits and vegetables. Those lean proteins, which can be, chicken, turkey, fish, those plant-based proteins, like lentils and beans. And whole grains, so things like brown rice, quinoa, whole wheat pasta, whole wheat bread. Those are kind of good examples of kind of overall healthy diet choices that can be helpful for your kidneys. When we get into stage 3, 4, and 5 of CKD, that's when it gets a little more tricky, and we might need to start restricting or limiting certain foods or nutrients. And so if you are in stage 3, 4, or 5, you may be talking with your doctor about any dietary restrictions, and you can work with your dietitian coach on that. So something like potassium, we talked about how that can build up in our blood, phosphorus, protein. Those are some things that as we get into the later stages, stage 3, 4, and 5, we might need to work with our healthcare team to limit. We have another follow-up question to that. What about salt substitutes? So that's a really great question. And so one of the most popular salt substitutes is actually a potassium-based salt. And so we need to be really careful, once again, depending on what stage of CKD you're in. We definitely don't want to be adding more potassium to our diet, especially if we're, in stage 4 or stage 5. And so that would be something to just be careful with. And definitely if you're using a salt substitute, mention that to your doctor, to your dietitian, and they can, help you further kind of understand what's going to work for your stage of CKD. That was a really, really great question. Okay. All right, how often should I have my kidneys monitored, or how often should I have my GFR tested if I have CKD? That's another really great question. And so once again, a lot of this does depend on kind of what stage you're in and talking with your doctor. So this may be something that they would want to monitor, do blood work every 6 months, or, if you're doing well, managing your CKD well, it may be an annual blood draw. But that would be something that your doctor will decide on what's best, frequency-wise to measure those kidney values. All right. Okay, another question here. If your doctor says you're in the first stages of CKD, is it reversible? So unfortunately, CKD, as I mentioned, it's not curable. And so this would mean that it's typically not something that can be reversed. So if you catch CKD in the first stage, that's really good, because then you can really work with your doctor, your dietitian, your healthcare team on all of these, diet and lifestyle factors that can really preserve the health of your kidney where it is. So, unfortunately, if your doctor, tells you you have a GFR that's in that stage 1 of CKD, it's probably going to not go back to a value that is, not diagnosed as CKD, if that makes sense. So unfortunately, it is not reversible, but very manageable, especially if you're catching it in the first stage, where our kidney function is still pretty good. Awesome questions. If you have any other questions, we still have some time here. I'd be happy to answer more. Okay, so I thought potassium was good for me. Bananas are healthy food. Is that something that I need to restrict? So once again, really great question. So if you're in the early stages of CKD, our kidneys should be handling our potassium okay. So if you're a big fan of, eating a banana, potatoes are another source of potassium. As long as your doctor hasn't given you any restrictions, that's okay. But if our CKD is now going into, stage 3, 4, 5, that might be something that you need to limit or moderate and not have quite as often to prevent that buildup of potassium. Okay, and then I do have more of an admin question here. So I jumped on the presentation late. Can a copy of the recorded presentation be emailed? So this presentation is being recorded and it will be posted on our Cecelia Health webinars page. So you can always go back and watch whatever part of the presentation you missed, or if your mind got going again and wanted to listen in again, please feel free to go back to that website and it will be posted. I'm not sure how soon it will be posted, but check back and you can always ask your coach about that too, and they can check for that. Okay, if you're stage 3 CKD, could the stage reduce to 2, or will it only stay? Unfortunately, I think the question got cut off a little bit. Let me see. Okay, if you're at stage 3, can it reduce to 2, or will only stay in the same stage or increase? That's a really great question. So all these are great questions. I know I keep saying that, but they really are. So it is possible if you say you have a GFR that puts you just barely into stage 3, there could be a little bit of movement with that GFR. It's possible it may move a few points up or down. So if you're kind of on that borderline of stage 2 and stage 3, it's possible to kind of be right on that line, but your doctor does take into consideration other factors along with that GFR that we looked at that tells you what stage you're in. So that's why we talked about how we can manage. So hopefully it will only stay the same and we can stay in stage 3 and not increase to stage 4 or stage 5. And another question here. What foods are high in phosphorus? Okay. So some foods that are high in phosphorus, let me get my list for you. But one thing that people don't know is that phosphorus is found in soda. So especially the darker colas. So something like Pepsi, Coke, Diet Pepper, those sodas all have phosphorus in them. And so if you do have CKD, especially 3, 4, and 5. You would want to try and stop drinking that soda. But when you think about overall health and trying to manage our blood sugar, maybe trying to drink more water and limit those sodas is good just for overall health. But when speaking about your kidneys and that phosphorus, that is definitely one beverage, those darker colored colas, to really limit. Any questions about that, you can always ask your coach or your doctor too. So things that are high in phosphorus, some nuts and sunflower seeds, cereals that are made from bran and oatmeal, and some of those whole grain breads. Those are foods that are just naturally higher in phosphorus. And some things that have phosphorus actually added to it. Some like pancake or biscuit mixes, the deli meats and hot dogs, fast food, some frozen foods, and many other types of packaged or heavily processed foods. So if you're curious, is there phosphorus added to this food that I'm eating? You can always take a look at the ingredients on a food label. If you see the letters PHOS, that means that there is some form of phosphorus in that food. It's not just going to say phosphorus spelled out like that. It might be phosphoric, it might be phosphate. So if you do see PHOS, that means there is phosphorus in that food. And so that leads me actually nicely into one of our closing slides here. So thank you once again for all of your questions. These were all really excellent things to think about. And if something isn't clear, once again, always ask your doctor or your dietitian coach on your next call. But we do have a really great webinar coming up next month. So healthy eating with kidney disease. So a lot of these, questions today were about diet and kidneys. And so this is going to be the one to attend. So August 16th, 7 p.m., that's Eastern time, so 6 p.m. Central time. This is going to talk all about managing your CKD through diet. So talking about those food choices, some things you may want to limit, and just kind of those practical recommendations too for how to actually make those changes in your diet to help preserve your kidney function. So I highly recommend joining that one. And the same way you registered for this one, you can access that as well. If you're having trouble or need the information sent again, please ask your coach. And we do have another one coming up in August as well, all about blood sugar. So if you are living with diabetes, this is, a great kind of basics of understanding, how to monitor your blood glucose levels, understanding those values, when to do it, how to do it. So if that is relevant to you, that is coming up on August 22nd, and this one is at 5 p.m. Central Time, 6 p.m. Eastern Time. And if you need some more support or more resources, once again, always ask your clinician, ask your dietitian coach. They'd be happy to share these events with you. We always have new ones coming up and scheduling them for you. You do have the option to sign up for text or email communication with your coach. So if you're interested in getting some more information and you haven't opted into that with your coach, just let them know that you'd like, some educational emails or a link sent via text to you, based on what you discuss on your calls together. We also have a Facebook page, Cecelia Health Coaching, so you can find us on Facebook, and we always love posting, interesting and helpful tips for you that you can hopefully, read and implement and, discuss with your coach.
All right. Thank you so much, Katie. That was wonderful. Thank you for all the great information and question answer session. And thank you, everybody who's listening and who joined us today and who had so many great questions. I hope I hope you found this helpful and just a good experience, and that you'll join us again for another webinar in the future, because we definitely appreciate your attendance and your great participation today. So that is the end of this webinar, and we hope that all of you have a great evening and stay healthy. All right, thank you.